Thursday, September 10th, 2020 is World Suicide Prevention Day. The theme this year is working together to prevent suicide. Join me, Dr. Ann Jaronski, Director of YSU Student Counseling Services, as I share information on suicide awareness and prevention so that we can all work together to prevent suicide. Welcome. I'm going to talk about suicide, how to recognize somebody may be in distress, and how to make an appropriate referral to get them help. This could be triggering for some of our viewers, depending on your personal and family histories. I want you to take care of yourself. It's okay to step away if you need to, and to use services to get yourself help and support. Why do we talk about suicide? Because we can intervene, we can make a difference, and we can save lives. There are 4 learning objectives for watching this video. The first is to be able to name basic world, national, and state statistics on the prevalence of suicide. The second is to be able to identify some of the common risk factors and signs of suicide. The third is to list questions to ask of somebody who may be suicidal. And the fourth is to be able to make an appropriate referral to resources for someone who may be suicidal. So what do we know about the prevalence of suicide? Let's look at worldwide, national, and state data to understand how big this issue really is. According to the International Association of Suicide Prevention, over 800,000 people die by suicide annually. This represents 1 person for every 40 seconds. And suicide is the 15th leading cause of death globally and accounts for 1.4% of all deaths. More men than women die by suicide. It's important to understand that there's no single cause of suicide. Suicide is the result of a convergence of risk factors, including but not limited to genetic, psychological, social, and cultural risk factors. Sometimes it's combined with experiences of trauma and loss. For every 1 suicide, 25 people make a suicide attempt, which is why it's really important for us to understand the signs and the risk factors so that we could appropriately intervene. For each person who dies by suicide, 135 people are in fact affected by that death. This equates to 108 million people bereaved by suicide worldwide every year. In the United States, in 2018, 48,344 Americans died by suicide. Suicide was the 10th leading cause of death, and there were an estimated 1.4 million suicide attempts. In the state of Ohio, the last year we have good statistics is from 2018. And in that year, 1,836 deaths were reported by suicide. Overall, it's the 11th leading cause of death in Ohio and the 2nd leading cause of death for ages 10 to 34. Nearly 5 people die by suicide every day in Ohio, and nearly 80% of suicide deaths are men. The data on these next 2 slides represents information that we've collected in the YSU Student Counseling Services about some of the students that we've seen. It's meant to illustrate that students are coming to us having issues that they've been dealing with for years and that are interfering with them on a daily basis. 29% of the students that we saw between July 1st, 2019 and June 30th, 2020 indicated that they self-injure without suicidal intent. 25% of our students have seriously considered attempting suicide, and 11.5% of them have made a suicide attempt. Again, these are students that we saw in the YSU Student Counseling Services. So at this point, I hope that you recognize that suicide is a problem worldwide at the national level, at the state of Ohio level, as well as even on our own campus. So how can you help? First step is really to know some of the risk factors and warning signs so that you can be ready to help somebody who may be in distress. Risk factors for suicide, just like risk factors for anything, really have to do with experiences that people may have had that may make them more vulnerable to a particular event, incident, or problem. So the kinds of experiences that people might have that could make them more vulnerable to suicide are things like mental health disorders, depression, anxiety, schizophrenia, some personality disorders, alcohol and other substance use disorders, hopelessness, impulsivity or aggressive tendencies, a history of trauma or abuse, major physical illnesses, previous suicide attempts, a family history of suicide, job or financial loss, loss of relationships, easy access to lethal means, local clusters of suicide, lack of social support and a sense of isolation, stigma associated with asking for help, lack of health care, especially mental health and substance abuse treatment, cultural and religious beliefs, especially beliefs that suicide is a noble resolution of a problem or dilemma, and exposure to others who have died by suicide, either in real life or via media and the internet. Again, just because somebody has had a risk factor or multiple risk factors does not mean that they will try to kill themselves, but that it makes people more vulnerable. And as you can see from this list, part of the vulnerability has to do with having dealt with situations that could be distressing, where there might not be resources to deal with them, where there's impulsivity and not the ability to slow things down or think things through. Those definitely exacerbate some of the risk factors that people have. The previous slide talked about risk factors in general, or for the larger population. Here are some specific risk factors for college students. It would be important, just like in the last slide, to say that just because somebody has had or experienced some of these issues does not mean that they will attempt suicide or will harm themselves, but these are risk factors that would leave somebody vulnerable, potentially without resources to support themselves or deal with additional stresses or traumas. So for students in particular, we look at a loss of previous support system and social network. So when students might have had a really tight network at home but go away to college and have to start over or don't have that support system, that potentially could be a risk factor. Academic stress, the need to, or the perceived need to achieve certain grades or grade point average. Increased pressure to succeed, whether that's internal or external from family or other people in their lives. Feeling isolated and not supported or not having people who understand them. Mental illness, lack of adequate coping skills. Any of us can have a lot of these stressors, but if we have adequate coping skills to manage them, they're less impactful overall. Conduct issues, previous suicide attempts, substance abuse, interpersonal difficulties, a history of trauma or abuse, impulsivity, fear of mental health stigma, which could make somebody not willing to seek help or seek services if they might be having an issue or problem. Insomnia. None of us think well or perform very well when we don't get adequate sleep. So these are some of the risk factors we look for in college students. So remember, the risk factors have to do with experiences that we've had or may have had that can impact who we are, how we see ourselves in our world, and how we function. Warning signs really mean behaviors that people exhibit. We may not always know somebody's risk factors, but warning signs are more observable. So the warning signs that we need to be concerned about are things like talking about wanting to die or kill themselves. Some people are that straightforward or upfront about how they're feeling and what they're thinking. So they will actually talk about it. Looking for a way to kill themselves, like somebody who's doing some research online or actively seeking out a way, buying a gun, hoarding pills, things like that. Talking about feeling hopeless or having no reason to live. Talking about feeling trapped or in unbearable pain, not being able to see a way out or not seeing that things could improve. Talking about being a burden to others or not wanting to burden other people. An increase in the use of drugs or alcohol. Acting anxious or agitated or behaving recklessly. Sleeping too little or too much. Withdrawing or isolating themselves. Showing rage or talking about seeking revenge. Extreme mood swings. Again, any one particular warning sign may not be indicative that somebody is thinking about harming themselves or killing themselves, but certainly when you hear a warning sign or you see a warning sign, getting more information or checking up on that person can be really helpful. So I started to talk about checking up on people. Let's talk a little bit more about what you could do to help prevent suicide. Again, this year's theme of World Suicide Prevention Day is working together to prevent suicide. One of the suggestions for this particular day, or really any day, is to take a minute to reach out to someone. It could be a complete stranger, a close family member, a friend, but the idea of reaching out, so breaking isolation, showing an interest, showing care, can help change a life. That is one of the things that we can do. Another thing to keep in mind and work on in terms of suicide prevention is to understand the importance of community. We are all part of a community, whether we're linked to family, friends, work colleagues, classmates, neighbors, or teammates. Sometimes we become isolated and disconnected from our communities. And if you remember some of the warning signs and risk factors, many of them had to do with being disconnected, feeling isolated, not feeling supported or understood. We have the responsibility to support and empower those who become vulnerable in our communities. So remembering that we're connected and working to ensure that we help maintain those connections is important. So what that means is reaching out to those in your community. If you're worried about somebody in your group, in your circle, in your community, reach out. Ask them if they're okay. Again, remember, we want to break that isolation and reinforce connectivity. By simply checking in with somebody, offering a non-judgmental support, you can often make a difference. We can also work to empower our communities. And by that I mean encourage those in distress to tell their own story in their own way and at their own pace. Just because we have a desire for somebody that we think might be in distress to tell us about it or talk to a professional about it, we also need to respect people's own pace at doing that. But we can engage in active listening and reach out to those who might be vulnerable. Let's acknowledge that no one has all of the answers. However, we can still play a positive role in suicide prevention. People are often reluctant to intervene when they're worried about others. They feel like they may not know what to say or what to do depending on how somebody responds. Maybe they feel like they're not the right person, they're not a professional. It's important to know that people in distress are often not looking for specific advice. They really just need to be listened to with compassion and empathy. And that's something any of us can do. So we've talked about some statistics, and suicide is a problem in all of our communities. No one's immune. We've talked about some risk factors. We've talked about warning signs. We've talked about the importance of community and reaching out. So how do you do that on an individual level? First thing is to listen. Again, we all just want to be seen, heard, and valued and believed. So stay calm. Take some deep breaths if you have to. Validate the person's feelings. Now's not the time to judge. Encourage the person to talk with a mental health professional. And if life-threatening, make the call to the appropriate professional. Okay, so now what do? You want to listen, you want to be helpful. It's okay to ask direct, pointed questions. It would be important to check your biases at the door. Now's not the time to have a debate about the moral issues of suicide or whether or not mental health or mental illness actually exists. Accept that you're going to feel uncomfortable, and that's okay. Don't downplay the issues and speak up over staying silent, meaning if you notice something, reach out, have a conversation. Don't try to avoid this difficult subject. It doesn't make it go away. Okay, so here are some specific do's and don'ts. Do talk to the person in private. This is not the conversation to have in a busy hallway or gathering of people. Do stay calm. Breathe. Calm yourself. Help yourself stay grounded and centered to have this conversation. Do listen. I always say to listen to understand, not to respond. So you're trying to understand that person's perspective. Do show support. Do act. Take care of yourself and your boundaries, and be concrete and specific. Don't ignore the problem. Don't say that you're going to keep something secret. Don't delay action. If there's an imminent danger to the person you're speaking with, don't leave that person alone. Don't try to cheer them up or give advice. And don't be vague or speculative. Now's not the time to beat around the bush. Okay, so a couple of slides ago, I mentioned there were several questions that I wanted you to be able to ask somebody who may be suicidal. And here they are. Are you suicidal? Do you have a plan? How would you do it? When would this happen? Do you have access to the means to do this? Reasons to ask these kinds of questions include being straightforward. Now's not the time to beat around the bush, to talk in euphemisms. It's really important to be straightforward and make sure that you're communicating clearly. Part of the reason for asking these questions is also to break down that barrier. There can be a lot of shame and guilt and isolation for somebody who may be feeling suicidal. To be able to talk openly about that can actually relieve a burden of hanging on to that themselves. It also enables you to have a better sense of how urgent it is that you connect somebody to additional resources. Here's a place that I also want to potentially bust a myth. If people are feeling or thinking that if you mention suicide to somebody, that just plants the idea in their head. I can tell you that it does not. If somebody is not thinking about suicide, asking them if they're thinking about killing themselves or if they're suicidal will not plant that idea in their head. But if somebody is suicidal and you ask them about that, you have now potentially opened a door to be able to talk about what they're experiencing and help them get support that they need. Now, as hard as all of this is to talk about when we're face to face with somebody that we care about or we're worried about, things get a little bit more complicated now that so much of the things that we're doing are remote. So let me throw in some information that'd be really helpful if you are trying to have this conversation with somebody and you're not physically in the same space with them. Because you might be talking to that person on some sort of electronic platform, whether it's email, video conference, phone, you may not know exactly where they are. Again, that's real different than if you're with each other in the same room. So information about location is really important if you recognize or learn that that person's in imminent danger and you need to send emergency responders to their location. So as soon as you begin to have any concerns about a student or a person, try to get their current address. It could be as simple as, hey, so where are you right now? Is that at your apartment? And the address is, or which apartment is that again? Or, oh, your home address. I don't know your home address. Where's home? It could be as simple as just straightforward asking. All right, I don't know about you, but these can be scary conversations to have with people. We want to do it right. We don't want to mess up. We want to get people help. We want them to be okay. And sometimes we don't know how to do this. So my next set of slides is about keeping calm and knowing your limits. I think it's really important to remind you right now that you're not a professional counselor. Unless you're a licensed professional. But most of you listening are not going to be professional counselors. So remember, that's not your role. You don't have to fix. You don't have to fix this other person's life. You don't have to fix this other person's problems. You can't control another person's recovery, meaning you can't control whether somebody is going to accept help or not. You can listen. That is your superpower in all of this. You can be present, meaning not distracted, not on your phone, not trying to do something else, but to actively listen to what somebody's saying. Be clear about what you can and can't do. And by this, I mean something like, be clear about not being able to keep secrets. When somebody's life is potentially in danger, that's not a time or a place where we can keep something secret or keep something to ourselves. We do need to get them help. So when should you call immediately for assistance? Well, if the person appears to be in imminent danger of hurting themselves or hurting somebody else, that warrants a call to 911. 911 would be our first responders. In many jurisdictions, that's law enforcement. That's why we have police on this slide. 911 is easy to remember. Here on the YSU campus, we're calling our YSU police. They're the ones that can get to us fastest to help us, help the other person, help provide us with support. Now let's talk about making a referral. So let's say this is not an imminent danger situation, but you're concerned about somebody's well-being, their mental health. You've seen some of the warning signs or some of the risk factors, and you'd like to get them connected with a professional. Okay, so the next step is, how do you help connect the person you're concerned about to a professional? And sometimes that's almost as hard for us as talking about whether or not they want to kill themselves, because sometimes it feels like we can let somebody down. So what are some of the phrases that you potentially can use to go from being listening, being supportive, but to refer this person or pass this person to the next level of care that they need? So here's some of the phrases that might be helpful to you. It sounds like you have a lot to deal with right now. It's hard to handle all of these emotions. I support you and I care about you. I appreciate that you trusted me to tell me, and I want you to be well. I don't have all that you need, but I can assist you in seeking a professional to talk to. So let's talk about some of the resources that are available to you and that person you're concerned about. The YSU Student Counseling Services, here's our information on this slide. We're available Monday through Friday, 8 a.m. to 5 p.m. Currently, we're doing all of our services via telehealth. So if you're concerned about somebody, the first step might be to reach out with a phone call. Let us know what's going on, and we'll help you figure out next steps. If this is after hours, weekend, holidays, I'm currently taping this on the long weekend. So you can still call our main number, and after the message, press 1 and your phone call will get transferred to a mental health professional. That person is going to be able to do the same thing that we would in terms of consulting with you. Asking questions, getting information, helping you come up with a plan of action, whether it's for you personally or for somebody that you care about or are worried about. While we were working remotely this spring and summer at the Student Counseling Services, we developed our social media platforms. We've put together some information to share with our campus community and other people around common issues and how to cope with them, as well as how to access us and our services. So check us out. We're available on lots of different platforms. This video is going to be uploaded to YouTube, so you'll be able to see us there. And we'll be putting out some messages on social media on how to find this and other videos. In addition to the YSU Student Counseling Services, where we provide free short-term confidential mental health services to our YSU students, our Student Outreach and Support Office also has a person of concern referral form. So once you've consulted with us in the counseling services, we may suggest that you submit a person of concern referral form. This is a great way to make sure that we're closing the loops and we're getting students support that they might need. Check out the Student Outreach and Support website to get more information. Additional local resources include the Help Network of Northeast Ohio. This is our local hotline or information and referral number. If you're looking to help somebody find resources in the community or didn't want to call the counseling services for some reason, the Northeast Ohio Help Network is a place to go. Here's the number for our YSU Police Department. Again, from a non-campus phone, you can call, or from a campus phone, you can call 911. It will ring directly there. From a cell phone or off campus, you need to directly dial the number, which is 330-941-3527. This resource is a national suicide prevention lifeline. You might have heard the telephone number before, 1-800-273-8255. It's a 24-hour toll-free suicide prevention hotline. They will often route them to your nearest call center, which in our area would be the Northeast Ohio Health Center. But this is a great resource. They also have good information on their website. Finally, 2 additional resources that could be very helpful is the crisis text line. You might have seen that, 741-741, to have a conversation or get support via text. And SAMHSA's National Helpline. SAMHSA is the government association that looks at alcohol, substance abuse, and mental health services. They also have some good information on their website that you can check out. If you have particular questions or concerns, please reach out to us at the Student Counseling Services at YSU. Again, our number is 330-941-3737. We're happy to try to answer your question or get you connected with the service that's going to best fit your needs. Thank you for watching.